Good afternoon, everyone. You're tuned into the Community Hour on Nusound Radio 92 FM with myself, Nish. Today is Tuesday, the 17th of December, and the time is just coming up to 12 minutes past 12. In the studio today, we are talking about TB, and I have some studio guests here, Susan, Kashmir, Suresh and Ola. Hello. Thank you so much for coming to Nusound Radio today.
That's all right. Thank you very much.
So please, would you like to introduce yourselves to the listeners?
Hello, good afternoon. I'm Suresh. I've lived in the London Borough of Redbridge for over 50 years. I have been doing a lot of voluntary work. Even when I was working, I've done a lot of voluntary work, including several subcommittees of NHS. I've been lecturer, teacher and a social worker in London Borough of Redbridge.
Hi, my name's Ola. I'm also working in Redbridge with Redbridge CVS, which is the umbrella voluntary group for the Borough of Redbridge. And today we're going to be talking about our TB awareness project, which I'll come back to after we've done the introductions. But I have been involved in working with communities. It's something I really enjoy for the last, say, 15 or more years. I can't match Suresh, but I think we all have a love of what we're doing and wanting the best for our communities.
Hi, I'm Susan. I'm a TB nurse. I work for Barking, Havering and Redbridge University Trust. I'm based at King George Hospital. We do outreach clinics at Loxford Polyclinic. I've been a TB nurse for too many years to mention, and I love my job.
Hello, I'm Kashmir Bajwa. I've been working for BHRUT for past 4 years in TB. Overall, I've been working for the Trust for 15 years in different departments. I'm the outreach officer at King George's. We deal with patients all over the community, in-house. We do home visits in the community, different hospitals. Whatever the patients need us, we try our best to meet their needs.
Okay, well, thank you all for coming to the studio today. And you're all talking about TB.
Yeah, we're talking about TB because this is a project that we're doing in Redbridge. It's a 6-month project for the moment, but we hope to extend it. So I'll just give you a bit of background. Basically, TB rates in London are generally higher than people would like. This is normally the case in large cities where people live very closely together, but they're also higher than we would like in Redbridge. So what has happened in Redbridge is that different agencies have come together to form a local TB partnership. It includes the public health, it includes the clinical commissioning group, which are the people that ask for services to be run. They're the ones that pay the money to run services that link to health. We're also partners with other voluntary groups in the borough, like Positive East, for instance, TB Alert, which is a national charity that's very keen on fighting the fight for TB, because nobody should have to go through TB. TB, by the way, stands for tuberculosis. And so the local TB partnership in Redbridge has created this project, which is called the TB Awareness Project. And what we do is we have recruited and trained local people as health buddies to go out into our different communities. A lot of the health buddies speak different community languages, and they go out to different groups, schools, places of faith, to share the correct information about TB, because there are quite a few misconceptions and wrong beliefs, and also people need to know where to access treatment and the kind of symptoms and so on, which we'll be covering today. So, for example, Suresh is a health buddy. I'm the TB coordinator for the project, and you've also met Susan, who's a TB nurse, and Kashmir, who's an outreach TB specialist. So you can see that amongst all of us, we all have different areas that we cover, but it's all part of this project to try and reduce TB in the borough, and also to make people more aware so they don't have to suffer needlessly.
Okay, and for our listeners who aren't too sure about what TB is, could you just explain it a little bit, please?
Yes, TB is a infection, and it is caused by airborne bacteria. But most important thing is TB is curable at all stages, and anybody can get TB. To think that I'm such an age or I'm such a status would stop them getting TB, that is not true. Anybody can get TB, but the TB treatment is free. That's the most important point. So you cannot put off TB treatment because it will cost you money. Even if your immigration status is not settled, even if you are a pregnant mother or suffer from HIV, etc., it is free to everyone.
Okay, so that's good that it's free. And you said at any age, and like anyone can get it, so young, old, it doesn't really matter. So if people think, oh, I might not be able to get it, I'm quite healthy, you know, there is still a possible risk.
Yeah, I mean, basically, a lot of people have many different views. I remember when I was telling my parents about doing this work on TB, the way they were sitting on the sofa, like away from me, as if I was contagious.
Okay.
But really, we want people to know that this is just like another illness, you know, like diabetes or asthma. But unlike diabetes or asthma, it's actually curable.
Okay,
TB is curable.
that's good.
But the thing is, maybe we could shed some light on some of the misconceptions that people have, because some people think that it's hereditary, that it's passed through family lines, but in fact it's not. So when you might find that, okay, my grandfather had it, say my aunt had it, my son had it, so people think, oh, it's all in that family. It's not. It's only in that family because the infection passed from one to the other, but it wasn't passed through family lines or hereditary. It was basically because they're living very close together with somebody who has TB. So anybody can get it, like Suresh has said, but it's not passed through sexual practices. It's not passed through sharing food or drink. If I have TB and I've had my treatment, so I'm no longer infectious, I lick a spoon. If you lick the spoon, you're not going to get TB. Okay. Even if I was infectious and lick the spoon, and you lick the spoon, you can't get TB from sharing utensils, crockery, food, drink. The other thing is some people think only certain people get it. You know, it's not for people who are of a particular class. Like Suresh said, some people think, oh, if I'm educated, I can't get it. That's not true. TB doesn't discriminate. Anybody can get it. I'm sure we'll cover more of these things. I don't want to hog the mic, so I'll allow somebody else to talk.
As I said, TB is an airborne bacteria, but you cannot get TB by shaking hands or spitting. Of course, spitting is not a very nice habit. You don't have to spit. Sharing food or drink does not give you TB infection. Using the same plates, cups or cutlery, sitting on the bus or sitting next to somebody who has got TB cannot give you TB.
Okay, so you said earlier that it is quite high in London, especially because people are living like closer together. Are there any other ways in which people can get TB apart from just, I don't know, living in small spaces?
Well, TB is a bacterial infection and it's only caught by somebody coughing. So if somebody has got TB of the lungs and they are coughing, then they will cough out the bacteria. And you actually have to have very close contact with that person to inhale the bacteria and therefore get the disease.
Okay, so what are the signs that people may have once they've got TB?
Okay, the signs are usually, I mean, some people don't get any symptoms at all, but it's normally is like having a continuous cough, and you've had treatment like a set of antibiotics on 2 occasions and you still think, God, this cough's not going away. You could lose appetite, you could lose weight, you keep getting continuous fevers, like you're well one day and the next day you can't do your general chores that you would do every day, feeling tired. If it's in the lungs, again, some people cough up blood, night sweats, basically not feeling well and not being able to get up and do what you normally would do. It's the best thing to do is go to the GP and speak to your GP and ask them to refer you to the chest clinic.
What you have to realise is that some of these symptoms are very slow onset. Okay. So you may get all these symptoms, but they are gradual onset. So you may not realise that you are absolutely tired. But when you think back 6 months, were you not just laying on the settee all day and you were feeling absolutely awful? It is a very gradual onset of the symptoms.
Okay.
Yeah, but at the same time, if you get any of these symptoms, it does not mean that you have got TB, because these symptoms can be presented by some other conditions or some other diseases. So the best is, as Kashmir said, consult your GP and the appropriate health authority.
Okay, we actually have got a text in from Raj from Ilford. He said his dad had TB and the doctor said it was due to a poor diet, and he wants to know if that's true. Can you get TB if you don't eat well?
Not at all.
Well, it's not that you get it because you don't eat well, but if your immune system is low, because, you know, if, for example, if you're unwell, if you don't eat healthily, then it means your immune system could be lowered. So you might be more prone to any kind of illness. But really the only way you can get TB is through the airborne bacteria.
Okay, well, do keep your texts coming in if you do have any questions about TB. Susan, Kashmir, Suresh and Ola are in the studio to answer any of your questions and to give further information. The text line is 07961 387 787. We're going to take a short little break now and we'll come back.